Good afternoon. This video is part of the series we started recently on Russian geometry pyramids in human health. The topic for today's video is Russian geometry pyramids and the increase in blood platelet count. First, for some facts about what blood platelets are and why they're important to us, I'm putting up some information from a website from the University of Rochester. To give some basic facts about platelets. Platelets are made in your bone marrow along with your white and red blood cells. And under a microscope, a platelet looks like a tiny plate. Your healthcare provider may do a blood test called a complete blood count to find out if your bone marrow is making the right number of platelets. A normal platelet count is between 150,000 to 450,000 platelets per microliter of blood. I just had this done earlier this year and I was at a little over 200,000, so pretty much right in the middle of the pack there. Risks, however, occur for spontaneous bleeding if the platelet count falls below 10 to 20,000, but when the platelet count is less than 50,000, bleeding is likely to be more serious if an individual is cut or bruised. When that condition of low blood platelet count occurs, the medical term for that is thrombocytopenia. And the next page that I'm putting up is actually from information from the Mayo Clinic, and it gives you a brief description of thrombocytopenia, which is a condition in which you have a low blood platelet count. Platelets, also called thrombocytes, are colorless blood cells that help blood clot. Platelets stop bleeding by clumping and forming plugs and blood vessel injuries. The next paragraph, thrombocytopenia often occurs as a result of a separate disorder such as leukemia or an immune system problem, or it can be a side effect of taking certain medications. It affects both children and adults. Thrombocytopenia may be mild and cause few signs or symptoms, but in rare cases, the number of platelets may be so low that dangerous internal bleeding occurs. Treatment options are available. And of course, the reason for this discussion today is there are treatment options that you probably won't hear about that you might want to consider as well, given the research results obtained through the Russian geometry pyramids. Coming up now is the page that describes briefly the test results. The purpose of the study was to see if there was an effect of water exhibited in the pyramid on the blood platelet count of rabbits. And the methodology employed possible changes in the blood coagulation system of rabbits when replacing normal drinking water with water exposed in the pyramid were investigated. Studies were conducted for 14 days. Blood from rabbits was taken before the start of consumption of pyramidal water, as well as on days 7 and 14 after the start of the experiment. The results of the test are as follows. The number of platelets of the rabbit before the introduction to the pyramidal water was taken as 100% and established at that rate. On day 7, after the start of the experiment, the number of platelet cells had increased to 129% of the value they had been a week before at the beginning of the study, and that's after 7 days of drinking pyramid water. And after 14 days of consuming pyramid water, the amount of platelets in the blood system increased even more to 167% of the original value established by drinking traditional water. So this tends to show that if you happen to be a person with low blood platelets, you might want to consider using a pyramid to improve your blood platelet numbers. You may also find it interesting that once again we're finding that immune function which we know from previous research that we've talked about in previous videos, is enhanced by being in the presence of the Russian geometry pyramid field. And since immune function seems to be one of the reasons why blood platelet counts can be low, this may be a way to increase your blood platelet count to appropriate levels through the exposure to Russian geometry pyramids. Hope this has been helpful, and you have a great day.